In that moment, I fought. I knew I had to fight. I knew she needed help.
Coming up, the fight to save her mom, plus that mom's new mission to save others from cardiac arrest. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. If your heart stops and you are not already at a hospital, the odds of surviving are stacked against you. The woman we're meeting today knows that she beat the odds thanks in large part to emergency responders and her daughter's quick action. But before we get to their story, let's get to our morning rounds. As people get older, one of the biggest questions is, can I keep driving? But there's another question they should consider. How can I keep driving safely? To explain more about that, we are joined by Olivia Desmarais, a registered nurse and injury prevention education specialist with the University of Kansas Health System's Trauma Department. And we asked her to join because this is Older Driving Safety Awareness Week. Olivia is also an instructor for a program called CarFit. CarFit is an older adult safe driving program. Olivia, what does it mean to fit your car, and what does it have to do with safety?
Yeah, great question. Thanks for having me this morning. So CarFit was designed by AARP, AAA, and the American Occupational Therapy Association, and it's meant to address how older adults fit in their car. We know that if we are fitting in our car properly, we'll be less likely to be in an accident, and if we are in an accident, we'll be less likely to be injured. So for instance, CarFit is a 12-point checklist, and we'll go through all of the different ways that we should fit into our car properly. So mirrors, we want to make sure that they're adjusted properly so that way we can adequately see our blind spots. That's going to decrease the risk of a collision. We want to make sure that feet are positioned well between the gas and the brake, so that way if you need to brake quickly, that you can do that comfortably and your path is clear. That's going to help you, again, avoid a collision if you need to push the brake quickly. And we want to make sure that you're sitting 10 inches away from your steering wheel. Airbags are designed to deploy at a high rate of speed. And if you are sitting too close to that steering wheel, it can actually cause injuries. So making sure that you fit properly in your vehicle can not only make you a safer driver, but make you safer in case you are in a collision.
Gosh, good tips for all. I was just trying to take some mental notes as you were saying that to make sure I'm doing it right. So let's say my dad doesn't technically fit his car. What does that mean? We just make adjustments? He needs to stop driving? What if he has a car that he just doesn't fit properly into?
Yeah, I think that's a great question, and it's a common concern for a lot of people. No, you absolutely do not need to buy a new car. You don't need to find a different vehicle or stop driving. That's absolutely not the case. The best part about CarFit is that we have specially trained occupational therapists that are there at all of the events, and we have a wide variety of adaptive tools that you can actually test and try right there with the physical therapist. We have seat belt adjusters, seat positioning adjusters. We also have really nifty things like a handy bar. It's like a 3-in-1 tool that you can use as a handlebar to get in and out of the car, but it also breaks glass in case of emergency and can cut a seatbelt. So we have lots of different adaptive equipment that can address those fit needs to make you a safer driver on the road.
So the Kansas Department of Health and Environment actually recently awarded the health system a grant for these CarFit events. When will the next one happen? And then we see in this video kind of how it works. Is there anything people need to know or prepare for when they show up?
Yeah, absolutely. So typically we host our events in the spring, summer, and fall. Our next event will be in spring 2024. Typically we host them at the Turning Point Resource Center here with the health system. But the best part about being a CarFit instructor, and this was a newly promoted position for me, I'm actually one of only 3 CarFit instructors in both Kansas and Missouri. So now I have the ability to go and teach CarFit coordinators to host this event. So say there is a program coordinator at at your local library, senior center, or community center, and they're interested in bringing CarFit to their center, they can contact me and I can train them to host their own CarFit events, which I think is just great. And KDHE's generous support is actually going to fund CarFit kits. There's a lot of the adaptive equipment, safety vests, cones, and it can be a little bit burdensome on these centers that want to bring this program. So I will actually have 3 kits that will be available for use for any CarFit coordinator that comes and gets trained with me. And so that way it's just less money out of their pockets, there's more support, and it'll be a little bit easier for them to host their own events. Yeah. So really excited about that grant, and we're really excited about what the events can bring. As far as what people can anticipate when they come, all they have to do is bring their car. We'll take you through the 12-point checklist. It takes about 20 minutes and you're in and out. It's a really fun event. You get a whole bag of goodies and educational material at the end, and I think people really enjoy it.
Yeah, Olivia, I love that, because nothing is more nerve-wracking than putting our older adults behind the wheel of a car, or our teenagers behind the wheel of a car. So just knowing that people are a little bit safer and going kind of beyond the safety belt to make sure that when they're on the roads, they're safe. We really appreciate this. Thank you.
Yeah, thank you.
Well, last year, Kim White asked her daughter, Kristen, to swing by for a routine quick visit. And as Janine Kiesling tells us, that quick visit turned into a close call.
You want to make a toast with me?
Kim White and her daughter, Kristin Halpin, have always had a special bond.
We celebrate our Fridays. We always look at the time on the clock.
But the tradition of toasting and celebrating anytime they are together on a Friday afternoon only began last year after a terrifying ordeal in Kim's Leawood home back on May 13th, which also happened to be Friday the 13th.
It was at 4:38, right, was the call.
Kim spent the day working in her son's yard and decided on a whim to invite Kristen and her grandson over for a quick visit, if they had time. Kim thanks God they did have time, because within 10 minutes of their arrival, Kim went into cardiac arrest.
She was showing me some landscaping photos of what she had been doing at my brother's house. Suddenly, she closed her eyes tightly, clutched her chest, and said my name 2 times, and then immediately lost consciousness.
When I passed out, Kristen went into an immediate engagement.
Kristen, who was 7.5 months pregnant at the time, knew her mother was in trouble. She was unconscious and wasn't breathing. Kristen immediately called 911.
One of those life-changing moments where it's fight or flight. In that moment, I fought. I knew I had to fight. I knew she needed help. And I didn't have a choice. There wasn't an option.
Kristen pulled her mother to the floor and started CPR.
The first responders and the chiefs who came here said clearly to us that day that there is an 8% chance of survival when cardiac arrest happens in the home. 8%.
Within 90 seconds, first responders, including firefighter Brittany Youngquist and master firefighter Travis Bloomingdale, were there.
Kim was down on the floor, didn't have a pulse, so we immediately took action.
In 2021, Kim was diagnosed with cardiac sarcoidosis. It can lead to scarring of the heart and interrupt the heart's ability to keep a rhythm. Kim has since had an internal defibrillator put in to make sure this doesn't happen again.
I know it's a hospital of excellence and academia and such, but it truly is also a hospital of hope. And that is always extended to me and to my family.
Kim also credits first responders with getting her to the hospital. She personally thanked them during a special ceremony at City Hall when Kristen was given a life-saving award. Kim now partners with Leawood Police and Fire to teach CPR in the community, like at her parish. Kim and Kristen have an amazing story and will never forget Friday the 13th and how lucky that day was for them.
It was one of the worst days of my life, which quickly became one of the best days of my life because they saved her and she was revived.
And we are so happy to have Kim White here with us today in the studio alongside her daughter, Kristen. We're also joined by one of Kim's cardiologists, Dr. Rhea Pimentel. She is an electrophysiologist, meaning that she specializes in those electrical signals that actually make our hearts beat. So So glad to have you all here together. Even while you're watching that peach, you reached over and touched Dr. Pimentel. I know it was emotional for you. What's it like to look back at that day?
Well, I thank you, Jessica. Thank you, all of you, KU and the media, and for creating the video that's emotional for me to review and powerful. And you understand, I believe when I say, thank you, Lord, for the gift of the day, of which I do every day, because I live with a grateful, healing heart. And the first thing that I would like to say, because I have the opportunity here, is to thank this extraordinary team of physicians, cardiologists that we have here at KU, who saved my life and continue to monitor me closely. Dr. Pimentel, nurses Sarah and Chelsea, Dr. Zubair Shaw, nurse Tamara Emek, Dr. Mark Hamlin, and the KU device team, who watch us with our devices and know our every heartbeat. So I just have to start by saying thank you. And to be here between two of my heroes
right.
is a humbled blessing.
Well, I could tell your heart is beaming with gratitude today, and we feel it. How are you doing today physically, and how is that heart doing?
I feel wonderful. I feel wonderful. And Dr. Pimentel will probably expand on that, but last April we put in a final device, and it's a CRT. And with that, my heart now is in synchronization, in beating. And with that, I had the joy to be able to attend my son's wedding in Beaver Creek in June. So again, beyond grateful, and I feel wonderful.
And we are glad you are here. Kristen, I'm watching that story and I'm thinking, how many times I've ran by my mom's house just to check on her, just run in and do something totally routine. And I'm thinking within minutes, you're now on the floor trying to save her life. You said it was like a fight or flight reaction. Take us back to that moment.
Yeah, it started off as an ordinary day, an ordinary Friday. It was Friday the 13th, but felt ordinary. And Mom asked us to come by, my son, who was not quite 2 at the time, and we came over for a visit, as we love to do. And we were sitting on the couch looking at pictures, and suddenly something changed. She closed her eyes, kind of put her hands towards her chest, and said my name twice. And right at that moment, I knew something was wrong.
How did you know to go into action? I mean, we think we're going to freeze up in that moment, but was there that feeling of, oh, something's different, I have to act now?
Yeah, I'm sure our physicians could probably explain the science behind that fight or flight right. Instinct that happens. But for me, it was the fight. It just, I knew she needed help. And growing up, I was taught when you need help, you call 911.
So you called 911, and then you get her to the floor, and you immediately started CPR. Did you already know CPR?
I did not. So really, I mean, from that point forward, it was the dispatcher that was absolutely incredible. The most compassionate yet firm instructions that I think I've ever received to get her on the floor.
So the dispatcher is walking you through this, and paramedics are already on the way. It takes them, what, about 90 seconds to get there? Did it feel like 90, or did it feel like longer?
You know, in those instances, time is hard to know, but I do recall it felt very quick that they got there, yes.
So once they get there, and let's just say we were actually going to invite who you call your second daughter. This is Brittany. She's one of the first responders who showed up to help you, and we called her this morning. She was supposed to join us, and she had to go out on another call to help save another life, somebody who also went into cardiac arrest. So our thoughts are with that family this morning. But I wanted to ask you, do you remember what you heard about when they got your pulse back? How did they get your pulse back?
From what I understand, when the fire department arrived, I had no pulse. I coded at 444, and they used an AED between compressions to shock me to bring my heart back. The first shock did not take. And so compressions continued. They administered a second shock, and then the heart began to beat.
So, and I'm going to ask you some of these CPR questions, and kind of a spoiler alert, because you now teach classes, and we're going to talk a little bit more about that. But because Brittany couldn't be here, you're going to kind of educate us a little bit on this CPR, because we know that these compressions involve a rhythm. There's kind of a way to do it. But are there any common mistakes that people make when it comes to CPR? People really want to do it right, but they're not always prepared.
You know, we have had 2 CPR sessions this year, one in February and one this last month in November. We've trained over 250 participants. And these are people that have come in and have left with the simple exercise of hands-on CPR. And with hands-on, I think, Jessica, from what our firefighters teach us, that the mistake is don't stop, is if they stop. Because within 30 to 40 compressions, they have a blood pool circulated. And at that time, it's ideal and you must continue. So a responder now hands-on CPR trained are asked to give at least 100 compressions. That's a very hard and frightening job.
Well, that's what I hear, is that it does take a lot out of you. You're going to feel like you want to stop, and you're saying, continue. Even when you want to stop, keep going.
Yes. And I believe as I was handed off from responder to all, I had a total of, with Kristen, 13 in my home. And that they did take turns in compression. And when the police officer came first, he asked 911, should I continue? And the answer was yes. And so the problem of being at home is how long have they been down unattended.
Kristen, tell us what's going through your mind. You seem emotional. So what was it like? You have you're just, again, this whirlwind moment happening. What's going through your mind?
Just remembering, is she breathing? It was just difficult to not really know what was happening, what had just happened.
What were your fears? Were you thinking
that I had lost her?
You thought you lost her?
Yeah. I mean, that's really what it looked like and what it felt like.
Okay, I have a surprise for you. Brittany, who's on duty, actually is with us now. So we wanted, Brittany, we were just talking about you. So Kim was kind of speaking for you because she's now educated in CPR and you've inspired her to help our community save lives. So want to bring you in. What do you remember from that day?
Well, first of all, good morning. So what I remember about that day that's really kind of stuck with me is just walking in, hearing that Kristen was doing compressions, so that had been going on, and then just kind of how everything just had a great flow to it. But just the fact that we already had someone there doing compressions was pretty memorable because that was like, okay, we've got that established.
So did it feel routine to you in the moment? I know it probably didn't, certainly to Kristen, but things were working and Kristen did exactly what she was supposed to do, correct?
Yes.
Called 911 and started those compressions.
Yep. That is the ideal best case scenario.
Tell us a little bit about what it's like when, because we saw in the video where the ladies came to see you and show their thanks and gratitude. What's it like to carry on this relationship with somebody whose life you saved?
It has definitely been remarkable. Usually in this kind of situation, you kind of ride with them to the ambulance and you have this kind of bond with them, and then you never get to hear what happened, so it's kind of always in the back of your mind. So to be able to have the follow-up, have the happy ending, it's been extremely rewarding and just a really good reminder of why I do what I do.
Oh, I bet. You're getting lots of food and lots of good kisses. I see Kim is not letting you get away from the hugs and kisses. Well deserved. And she calls you her second daughter. So is there anything you would share with Brittany?
Brittany stayed with me through it all. She went in the ambulance with me. I found that to be amazing, and she stayed with me until she handed me off at emergency at the hospital.
What's your message to Brittany and her team?
Oh my gosh, we would be lost without you, Brittany. We'd be lost without you and all of our first responders who helped us that day. So thank you for everything that you do for everyone and for us.
Brittany, so glad so glad you were able to get on with us. I know you're busy this morning doing your thing. When all of this is said and done, you land in the hands of Dr. Pimentel. So I want to talk about Kim's heart. Welcome. What's it like to hear this whole story unfolding?
Scary, gratifying at the same time, and really, very inspiring, honestly.
So let's talk about the condition that she had. Kind of explain that and how it might differ from other heart conditions.
Yeah, so Kim has something called sarcoidosis, which we initially identified in the lungs. and then has since identified in the heart. And so sarcoidosis it's actually a little bit of an autoimmune syndrome where you get a bunch of inflammatory cells that sort of clump together and deposit themselves in different organs, the lungs and the heart being some of them. When it deposits in the heart, it causes something called granulomas, and those can affect the heart conduction system, so how slow or how fast the heart beats, and then in some patients can also affect the heart muscle function itself. So in Kim's case, she initially presented with complete heart block, meaning that the top and bottom chambers of her heart did not talk to each other, and she needed a pacemaker. And I very much recall her first coming into my office and saying, but why? Why did this happen to me? I am very healthy otherwise, which was kind of a head scratcher. And through further evaluation, we figured out that this is what she had. Now, patients with cardiac sarcoidosis are at higher risk for developing these ventricular arrhythmias that can cause sudden death.
So how would someone know they have it? Are there any signs?
The signs are very nonspecific. It can be fatigue, it can be shortness of breath. The biggest thing for us in the cardiology standpoint is that they typically have rhythm abnormalities.
So would she know that? Would she feel that?
I think you had some lightheadedness, and so she didn't have her initial pacemaker placed at this institution, but I think that was the inciting event, is that you were lightheaded, maybe passed out, maybe had some fatigue, shortness of breath on exertion.
So then you had a pacemaker put in.
Got a pacemaker put in, and then the backstory was trying to figure out why she developed this heart block, because she's otherwise a healthy person. And that's where we got to the cardiac sarcoidosis diagnosis.
So you shared a readout from Kim's pacemaker on the day of the cardiac arrest. I'm going to pull this up and just show us what we're seeing here.
Yep. So this is a continuous strip
from the top to the bottom.
So it starts in the top and then goes down to the second row, and it's really her ventricular, so her bottom chamber beating. And you can see the first two beats the heart rate is slow because they're kind of far apart, the tall, skinny things. And then all of a sudden she goes into this rhythm where the signals are very close together. The closer they are, the faster the heartbeat. And then at some point, she changes into that really ugly looking thing that looks like just noise, and that's ventricular fibrillation. So if I were to guess, when she started clutching her chest was when that fast heartbeat started, and then when she went into the fibrillation, the kind of noise-like signal, that's when she actually passed out. So the key to understand here is a pacemaker, while it does a lot of great stuff in keeping the heart rates up, doesn't do anything for fast heartbeats. So this pacemaker recorded this whole event. If you actually looked at the entire event, you could see her doing CPR, because you could see the noise artifact from it, and you could see the shock that occurred through the AED.
So she was outside in the heat, working, doing kind of her normal thing. Would that have had anything to do with it, or could it just be anything that would trip that?
It probably didn't help. I would gather that maybe you were a little bit dehydrated from a day working outside, but unfortunately in patients with cardiac sarcoid, we see this even without any instigating effect.
So somewhat of a ticking time bomb.
A little bit.
Okay, so let's talk about the internal defibrillator. Tell us a little bit about that.
So the defibrillator, as I mentioned before, is a little bit different than the pacemaker because it will also take care of those fast heartbeats. So that rhythm that you saw on that electrogram strip would have been taken care of with the defibrillator by shocking her internally. So we made that decision, obviously, when she came in after dying, that, hey, maybe you need a defibrillator. So we went ahead and upgraded her device to a defibrillator.
Good, an upgrade. You needed that. You wanted that. Let's talk about CRT, this type of therapy.
So fast forward, she does really well, except Kim comes back and complains to me that she's short of breath and she's kind of tired and she's got this big wedding, and I had promised her for like a year. I promised her, you're going to make it to this wedding and it's going to be amazing and it's going to be awesome and you're going to have such a great time. And I think you came back and said, I don't feel good. And I looked at the way that her heart was beating, and because she has, quote, complete heart block, one side of her heart pulls in before the other side. So instead of having a nice synchronized squeeze, she's kind of out of sync. And so what we did with the last device is we added a third wire on the other side of the heart, and we made both sides squeeze at the same time to provide synchrony and to kind of help with some of her symptoms.
I love it. As a doctor, you're not just getting them healthy, you're getting them to those weddings and getting them back to time with their grandkids. So it's that bigger picture that we're talking about. And part of this bigger picture is through all of this, as we've been talking about earlier in the show, that you started teaching CPR classes. So was this something you knew immediately? I got to get out there and help people. I got to help save people's lives the way mine was saved.
The question I ask every day is, what do I do with this, and how do I give back? And so, and it is the fire department of Leawood who graciously does this task as their community civic service. So they're the ones who are the teachers, and we set it up with a group of friends who are my family, and people are all welcome to attend, and it's through their instruction, and they give instruction both on the adult and as well as child. So it's a wonderful, fascinating educational program.
Well, it's exciting to see you standing up there in front of everyone else sharing your experience, and you're living proof that it works. Dr. Pimentel, I know you've got to get going here in a moment, so I want to get your final thought today, and just what is the takeaway for somebody listening to this story? What do you want them to go out in the world and know?
Well, I think learning CPR is obviously important, and Kristen will tell you she didn't know CPR beforehand, but she tried. You know, and I think that's what we see a lot in these out-of-hospital arrests, is that there may be people around and they get nervous and they get scared and they don't want to do something wrong. They want to, you know, call 911 and just sit there. But honestly, what she did brought your mom back, and you brought her back the way you wanted her to bring her back, right? She didn't have any deficits whatsoever because of that CPR. And so, so I would just encourage anybody, if you see somebody go down, do something about it. You know, don't, even if you don't think that you're the best at it, just do it, because something is better than nothing.
This is one of those things. Just try, because it could have a great outcome.
And remember, you don't need to do the, you know, the AHA a few years ago went to just hands-only CPR, so you don't need to do the rescue breaths.
That was another question that was coming up later. So no rescue breaths are necessary anymore. Okay, good to know. All right, have a wonderful day. Have a great weekend. Thanks for being with us today.
Thank you very much.
Okay, so if you have any questions for Kim or Kristen or Brittany, just give us, send those in. We're going to put some information, I think, up on our screen. We got that. There we go. You can send them in all of those ways. And then we're going to get over to Dr. Dana Hawkinson. And there we go.
Yeah.
There we go. You're good. You're good, Dr. Pimentel. Thank you. Have a great day. Okay, so Dr. Hawkinson, let's get to our COVID count.
Yeah, so again, we've had slightly higher levels in the past few weeks, although just a little bit lower than the last 2 weeks. You have 19 active infections in the hospital, down from, I think, 20 and 22 the previous couple weeks. But still, you know, we're happy that these numbers are low, would like them lower, but overall we know that circulation of SARS-CoV-2 in the community is a little bit higher now, especially compared to the summer months.
Okay, question about, we're going to be talking about wastewater, but a lot of people getting COVID, but they're actually not getting sick enough to go to the hospital, which of course is the whole point of getting vaccinated. But the CDC released a new map showing virus levels in the wastewater. We're going to pull that up. Kansas is one of the few states showing up in dark blue, meaning that those virus levels are high. What do you make of this?
So this is the National Wastewater Safety Surveillance, and they are looking for SARS-CoV-2 in this. And we know Dr. Stites has frequently talked about this and has talked about wastewater surveillance for quite some time. So this is a new map. The CDC, this is publicly viewable data on the CDC website. So what that map shows is that there are, you know, over 1,000 sites in the United States that are tracking and monitoring SARS-CoV-2 in the wastewater. That does include 3 territories and 5 tribal organizations as well. It does cover over 119 million people in the United States, so it's a pretty good sample size. And basically what that map was showing was the change from baseline levels of SARS-CoV-2 detection in the wastewater. And what does that mean? What is the baseline level? Well, for every state, it's going to be a different baseline level. So we aren't necessarily comparing in Kansas our numbers to another state as well. Those numbers, those baseline levels, are updated every 6 months. And so when you see that dark for the Kansas, that means that it is overall changed from what it had been in the previous 6 months. But overall, it is higher, and I think that's consistent with what we're seeing either in the hospital with our admissions, but also anecdotally when people know friends and family that have it. So I think this is a very good thing to do. Why is this helpful? Because it can help inform us maybe a week or 2 or 3 weeks before actual increase in diseases, because we will see increased detection in that wastewater. People can then do any other new protective measures that they would like to help reduce their chance of getting infected. So I think this is a very good thing, and we will see how these numbers change. But again, this is a long-term thing. They update baseline levels approximately every 6 months, but they do the testing weekly, and they reporting should be about weekly on any change in that activity of the detection of the virus.
Question for you, Hawk, from a viewer that was sent in. This woman, Gretchen, said that she recently got the COVID vaccine, and she is curious if there's a way to measure or test if the vaccine had any effect on her heart.
Yeah, I think that's a difficult question. So I think this question we need to kind of just detail out. It sounds like this is an acute issue, because I think we know that, I'd like to preface this, we know that there can be side effects with the vaccine, but there also can be complications with the infection itself. And what we have shown is that the vaccine is far, far safer in getting than the infection. The vaccine will help reduce those complications, and those complications can occur in higher predominance than any side effect. So it's unclear if you are having symptoms. If you are having symptoms, certainly there are things to do to look at the heart, and certainly Dr. Pimentel would have been good to help answer this. They can start with looking at an EKG, which is just looking at the heart electrical activity, as we've heard about, but also imaging such as the MRI. They can do MRI of the heart to look for any damaged areas. And so I think we have to understand, are you symptomatic, or are you just wanting to know if there's any damage to your heart? I would say that unless you're symptomatic, there's probably no reason to be evaluated by that. But if you have concerns, certainly ask your physician or your medical team if you're able to, and hopefully that answers your question.
All right, Hawk, thanks so much. All right, so questions coming in, but Georgianne has a couple of comments. Just amazing that Kim's 2 daughters were able to help save her life. And she said, great job, Kristen. How horrifying, but with a great outcome due to your quick action. Question from, let's see, let's get to this question. Well, let me ask you this. Jeremy wants to know, Brittany, is there a difference between cardiac arrest and a heart attack? And does that make a difference on how somebody at home while they're waiting for you to arrive should perform CPR, or does it not matter? Oh, you just unmute yourself if you can. It's okay.
I apologize. We've been getting tones going off.
You're good.
As far as the standpoint from at home between the difference, you're not going to be able to tell that outside of the hospital. You're not going to be able to know exactly what's going on. So as soon as you do see somebody go down, as long as they, don't have a pulse, aren't breathing, start compressions. At that point, you're not looking at what's going on inside of them, what is going on with their heart. We would much rather have you caution on the side of error and start those compressions than be like, oh, this might be something else. This might be a stroke. It might be a heart attack. It might be cardiac arrest. I don't know what it is. So from our standpoint, we're not there to diagnose. That's where, the amazing people like Dr. Pimentel come in to diagnose what exactly is going on. Just from the initial standpoint of going in, just start those compressions.
Sure, just get after it. Something's wrong, get after it and start those compressions. Joellen just made note of that paramedics were only about 90 seconds away. Is that pretty unusual?
That, for us, it kind of depends on where you are in the city, but how we are. We have 3 different stations that are spaced out pretty evenly, but that's fairly accurate. Our goal is to get our gear on, get in the truck, and be out of the station in under 60 seconds. That's maximum.
And then, Ruth just mentioned dispatchers are awesome. We know they are. She said they led me through an experience with my husband. The paramedics and the firefighters showed up, and they were so reassuring. So just lots of shout outs to just our first responders who are doing so many great things each and every day. Was that pacemaker, another question is, was the pacemaker able to give any sort of heads up that something was happening? I mean, we saw after the after effect, but does anything that you have now implanted give any sort of heads up that something might be coming down the pike?
That one I don't know about if an event would reoccur, but because it is a defibrillator, it is meant to then induce its own shock if my heart would go into arrest.
Right.
And I didn't have that with the pacemaker.
All right, I want to get our takeaways today, and I do want to start with Brittany. We're just so glad that you were able to get on with us today. For folks who are listening right now, what do you want the takeaway from this story to be?
Yeah, as Dr. Pimentel was saying earlier, go out, find a local class that teaches CPR. They're free. Your local fire department, we do it once a month, and just take the class, make it a family event. Kids, elderly, anyone's able to do it. And it's definitely a skill that hopefully you don't have to utilize, but it's good to know. So I would say get out, get that knowledge.
Brittany, thank you so much. Thank you. Have a great weekend. Yeah. Stay safe out there.
Thank you.
All right. Kristen, for people watching, people who are swinging by to see someone and then they have to go into this quick action, what's your advice? What's the takeaway?
Yeah, I would say seeing someone you love hurt like that is really hard, but you can do it. You can do it. You can help them. You can do what you need to do to start. Call 911. Do what you can, but you can do it.
You've got this,
yeah.
Right? Miss Kim, I'm going to let you wrap us up today. You've got so much to say, and I'm going to let you have the floor.
Chief Kaplan of EMS would say she was 7.5 months pregnant. You can do this.
Oh, by the way.
Do this. and please engage, and please choose to engage, because by doing so, Brittany, all the first responders, EMS would say we can save more lives. The challenge coin that they gave Kristen in this honor, it reads, to save one life is as if to save the world. And she is my world, and my KU doctors are my world, and my family and my friends that support us are my world. And again, with such a grateful heart, I just want to finish by saying I do have a 68-year history with the University of Kansas, because I was born in this hospital.
You were?
I was born in this hospital. I went through breast cancer with Dr. Kaplan and survived that treatment. And I live today. I live today because the cardiology department, the pristine doctors, the extraordinary care, and all that I have here at KU. Today is Red Friday, you know, and I meant it for Heart Friday as well as the team. And I just want to, in a very special way this weekend, recognize cardiology and all of the patients that join me in saying thank you. Thank you.
I'm not quite sure we could wrap up the day, the show, the week any better than your message. So thank you, and we're just glad you're here.
Bless you.
Thank you so much. All right, everyone, thank you to all of our guests today. Thanks to our viewers for being with us, and we'll see you back here on Monday. Coming up Monday on the Morning Medical Update, Narissa Elrod lost her mom to a rare disease of the brain's blood vessels. Then she got the same diagnosis. I'm Jessica Lovell. On the next Morning Medical Update, we go behind the scenes to see the brain surgery that is making sure Narissa's future is bright. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.